everybody, welcome to today's topic on first aid. And today I'm going to talk about anaphylaxis. Okay, so what is anaphylaxis? It is also known as anaphylactic shock, and it is a severe and potentially fatal allergic reaction which affects the whole body. Okay, so although there are many causes for this type of severe allergic reaction, the most common cause is eating a food to which the person is allergic to, or if you are in a remote setting, insects, stings or bites is one of the commonest allergic reaction. And it can be a skin-to-skin contact, it can be through medication, stings like I mentioned, or even by touching the mouth with contaminated hands, utensils or toys. Now, an anaphylactic reaction can occur suddenly, within seconds, or even take up to at least 1 hour or more for the allergic reaction to develop. And anaphylaxis, requires immediate and definitely immediate medical treatment. So what is the common causes of anaphylaxis? Anybody? Okay, allergies. It can be caused by a lot of different things, okay, and these are known as allergen. Now, the following are a list of common allergens that you may want to take note of. Peanuts, okay, fish, tree nuts, shellfish, eggs, dairy products, and bee stings, okay. So, allergic reaction can be developed in 4 different types, which is skin contact, ingestions, which is taking in through oral, injection through penetrating into the skin, or even inhalation. So, what are the symptoms of anaphylaxis or anaphylactic shock? Although there is a wide range of symptoms that occur with anaphylaxis, not all of them will be experienced on each occasion. Now, the symptoms can vary in severity, and of course, it can happen even to the same person. Now, rash or hives anywhere in the body, swellings in the mouth, face, and lips, difficulty in breathing, abdominal cramps, sudden feeling of weaknesses, and collapse in unconsciousness, and alteration in the heart rates. So what happens during an anaphylactic shock? When a person comes into contact with the allergen, it may cause a number of different chemicals to be released in the body, in which can have an effect on their organs. Now, during anaphylactic shock, the blood vessels leak, bronchial tissue swells, and it can cause a person to choke and collapse, and that is when the blood pressure drops. Now, what are triggers in a remote setting? It is the stinging insects, and most frequent culprits are bees, yellow jackets, hornets, and wasps. Now, the progression of this reaction usually begins within minutes of exposure, and in some cases it can occur several hours later, and this is called a delayed reaction. And some are in phases where we call biphasic reaction, where it can be potentially dangerous if mild initial symptoms are ignored or undertreated. Okay, now when someone says a reaction is beginning, take it seriously. Okay, symptoms may be felt even before they are noticeable to others, and it's easier to stop the reaction in its early stages. And usually epinephrine is most effective in the use of early reaction. So the treatment, number 1, okay, anaphylaxis definitely requires an emergency treatment. Now, lie the person flat and elevate the feet unless this makes breathlessness worse. An adrenaline injection in the form of epinephrine can be prescribed by a doctor should it be used promptly or as directed, as the first sign of swelling in the mouth or throat, breathlessness is seen. Now this should relieve the breathing problems, raise the blood pressure, and reduce the swelling. An ambulance must be called immediately, and if there is no improvement of symptoms get worsened, a second adrenaline injection can be given within 5 to 10 minutes. If it's in a less serious reaction such as a rash, it can be treated with a antihistamines, another form of drug. Now, when you handle emergencies, epinephrine is the only proven emergency treatment for anaphylaxis. Now, do not hesitate to use the epinephrine auto-injector, or we call it EpiPen, as prescribed, as it is easier to stop the reaction in its early stages. Now, harmful side effects are quite rare. However, the beneficial effects that the injection should actually last 15 to 20 minutes, and if symptoms do not subside or if the symptoms occur, a second injection may be prescribed within 5 to 10 minutes after the first dose. So there are instructions on how to administer the EpiPen injection in an emergency situation. Now, a person